So hello, I am Cassandra Nicole Marñaol and I'll be discussing the learners with visual impairment and hearing impairment. First, we have the students who are blind or have low visions. So blind and low vision. So a question people ask often is what's the difference between someone who is blind and someone who is visually impaired? So what's the difference between visual impairment and blindness? So the definition of visual impairment is a decrease in the ability to see a certain degree that causes problems not fixable by visual means such as glasses. While blindness is the state of being unable to see due to injury, disease, or genetic conditions. So we have four terms used to describe different levels of vision impairment and blindness. We have the partially sighted, low vision, legally blind, and totally blind. Partially sighted means a person has a partial vision either in one or both eyes. Low vision refers to a severe visual impairment in which visual acuity is 20/70 or poorer in their best seeing eye and cannot improve with glasses or contacts. Legally blind means a person has a corrected vision of 20/200 in their best seeing eye, while the totally blind refers to a complete loss of sight. So the types and causes of problems of vision. We have two. We have the most common adult vision problems and childhood vision problems. First, we have the most common adult vision problems. We have the blurred vision, AMD, or the age macular degeneration, the glaucoma, cataract, and diabetic retinopathy. Blurred vision. So when we say blurred vision, it is the loss of sharpness of eyesight, making objects appear out of focus and hazy. The primary cause of blurred visions are refractive errors such as nearsightedness, farsightedness, and astigmatism. So what are the causes? We have here the family history and the advancing age. Second, we have the age-related macular degeneration. So AMD is a disease that blurs the sharp central vision needed to see straight ahead. It affects the part of the eye called the macula that is found in the center of the retina. So the macula lets the person see fine details and is needed for things like reading and driving. The causes are the type 1 or 2 diabetes, poor control of blood sugar level, high blood pressure, high cholesterol, pregnancy, and smoking. The third one, we have the glaucoma. So there are different types of glaucoma, but all of them cause vision loss by damaging the optic nerve. Glaucoma is called the sneak thief of sight. So because people don't usually notice a problem until some vision is lost. So the causes are anyone can have glaucoma. But some people are at higher risk of developing the disease, such as people over the age of 40 to 60. And of course, those with the family history of glaucoma. So we have here the cataract. So it is the clouding of the lens of the eye. Cataracts are most common in older people but can also occur in young adults and children. So cataract treatment is very successful and widely available. Causes. Cataracts are more common after the age of 40. But then, pwede silang mag-occur kahit bata pa. And certain diseases such as diabetes, smoking and alcohol use, and too much exposure to sunlight. Last, we have the diabetic retinopathy. So all people with diabetes, both type 1 and type A, are at risk of diabetic retinopathy. So it is caused by damage to blood vessels in the back of the eye or the retina. So the longer someone has diabetes, the more likely he or she will get diabetic retinopathy. Causes: type 1 or 2 diabetes, poor control of blood sugar level, high blood pressure, high cholesterol, smoking, and pregnancy. So we have here the second one, the most common childhood vision problem. We have the blurred vision, the crossed eyes, and the lazy eyes. So the blurred vision, It is the loss of sharpness of eyesight, making objects appear out of focus and hazy. So the primary causes again are the refractive errors such as nearsightedness, farsightedness, and astigmatism. So the history of the causes are the family history, so parents who have one or more refractive errors, and advancing age. Second, we have the crossed eyes. So strabismus occurs when the eyes do not line up or they are crossed. One eye, however, usually remains straight at any given time. So the causes are family history, having significant amount of uncorrected farsightedness, disabilities such as Down syndrome and cerebral palsy, and stroke or head injury. So lazy eye. So problem that is common in children. So it is the reduced of vision in one eye caused by abnormal vision development early in life. So causes is the premature birth, low birth weight, retinopathy of prematurity diagnosis, cerebral palsy diagnosis, intellectual disability diagnosis, family history of certain eye condition, maternal smoking, drug or alcohol use, and surgery on eye muscles for esotropia. So, we have here the education of students with visual disabilities. So when a child has a visual impairment, learning and development may need to be supported throughout the school years. So often children require some training and instructions from teachers who specialize in working with blind and visually impaired students. Your child might also need certain accommodations like books or materials in formal like braille. Or a seat near the front or back of the class in order to participate fully in the classroom and in extracurricular activities. Next, we have the students with hearing impairment. So hearing impairment or disability, deaf and hard of hearing. So hearing impairment is defined by IDEA as an impairment in hearing, whether permanent or fluctuating, that adversely affects the child's educational performance. Deafness defined as a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing with or without amplification. Hard of hearing. Hearing loss where there may be enough residual hearing that an auditory device provides adequate assistance to process speech. So deafened and hard of hearing individuals may choose to use hearing aids and or assistive listening devices to boost available hearing. So alternatively or in addition, they may read lips, use sign languages, sign language interpreters, and captioning. So people who are deaf or hard of hearing may have speech that is difficult to understand due to the inability to hear their own voice. So classification of hearing impairment. So how does hearing loss occur? So the ear is made up of three sections: the outer ear, the middle ear, and the inner ear. So the outer ear consisting of the ear and the ear canal. The middle ear is the home to the mechanical portion of the ear consisting the three smallest bones in the body and the eardrum. So the inner ear is the house of the cochlea, the hearing, and the balance organ. When all the three sections of the ear work together in unison, hearing is seamless. The sound waves are directed through the ear to the hearing processing center in the brain. However, when there is a breakdown along the way, a person can experience mild to severe hearing loss. Let's explore the main types of hearing loss. So we have the three basic categories of hearing loss: the sensory neural hearing loss, conductive hearing loss, and mixed hearing loss. Sensory neural hearing loss. So it refers to a problem located in the inner ear or along the nerve pathway between the inner ear and the brain. So this type of hearing loss occurs when the inner ear is or the actual hearing nerve itself becomes damaged. So this loss generally occurs when some of the hair cells within the cochlea are damaged. So sensory neural loss is the most common type of hearing loss. It can be a result of aging, exposure to loud noises, injury, disease, certain drugs, or an inherited condition. So this type of hearing loss is typically not medically or surgically treatable. However, many people with this type of loss find that hearing aids can be beneficial. So what are the causes? Exposure to loud noises, aging, head trauma, virus or disease, autoimmune inner ear disease, heredity, malformation of the inner ear, Meniere's disease, otosclerosis, and tumor. Second one, we have the conductive hearing loss. So, it refers to a decrease in sound caused by a problem in the outer or middle ear. So, this type of hearing loss occurs when the outer ear is or middle ear where sound waves are not able to carry all the way through the inner ear. Sound may be blocked by earwax or a foreign object located in the ear canal. The middle ear space may be impacted with fluid infection or a bone abnormality. Or the eardrum may have been injured. In some people, conductive hearing loss may be reversed through medical or surgical intervention. Conductive hearing loss is most common in children who may have recurrent ear infections or who inserted foreign objects into their ear canal. What are the causes? Malformation of outer ear, ear canal or middle ear structure, fluid in the middle ear from colds, ear infection, allergies, poor eustachian tube function, perforated eardrums, benign tumors, impacted earwax, infection in the ear canal, foreign objects in the ear, and otosclerosis. Last, we have the mixed hearing loss. So it refers to a conductive loss and sensory neural loss occurring at the same time. So sometimes, people can have a combination of both sensory neural and conductive hearing loss. So they may have a sensory neural hearing loss and then develop a conductive component in addition. So hearing testing is critical for discovering exactly what type of hearing loss you have and will help determine the hearing care solution that is right for you. Hearing aids are available in many sizes, styles, and technologies. There are also many alternatives to hearing aids. So hearing loss in adults, people over the age of 50 may experience gradual hearing loss over the years due to age-related changes in the ear or auditory nerve. The medical term for age-related hearing loss is presbycusis. Having presbycusis may make it hard for a person to tolerate loud sounds or to hear what others are saying. So other causes of hearing loss in adults include loud noises, heredity, head injury, infection, illness, certain prescription drugs, and circulatory problems such as high blood pressure. So, we have here the characteristic of persons with hearing impairment. So, common difficulties often experienced by a child with hearing impairments are language delay disorder, speech delay or disorder, sensory processing, attention and listening difficulties, behavioral difficulties, poor condition, gross motor difficulties due to middle ear dysfunction affecting balance, difficulties with reading and spelling, performing poorly at school, and lack of response to loud or sudden noises. So thank you for listening. That's all for today. Have a nice day ahead.